Unseen expenses, the true cost of healthcare in the United States. The American healthcare system, renowned for its cutting-edge treatments and technological advancements, often obscures the true extent of its financial burden. Many of the most significant costs are less visible but equally impactful, despite the frequent emphasis on insurance premiums and co-pays. These concealed expenditures encompass exorbitant prescription drug prices, unpredictable and opaque pricing structures, and spiraling administrative costs. Furthermore, the financial burden that individuals and families bear is further exacerbated by the economic strain of preventable diseases, disparities in access to care, and the indirect costs of caregiving and lost productivity. The pursuit of health and wellness can be transformed into a complex financial labyrinth for many individuals as a result of the reality of these invisible expenses. Consequently, the true cost of healthcare is significantly greater than what is immediately apparent, impacting not only patients but the entire economy. It is imperative for individuals who aspire to effectively navigate the American healthcare system and advocate for meaningful reform to comprehend and address these concealed costs. By highlighting these frequently disregarded elements, we can gain a more comprehensive understanding of the healthcare expenses that Americans encounter and strive to establish a more transparent and equitable system. 1. Exorbitant administrative expenses. The high administrative costs associated with administering the system are one of the most significant unseen expenses in American healthcare. The U.S. healthcare landscape is characterized by a multiplicity of private insurers, government programs, and healthcare providers, which necessitates extensive administrative processes. These encompass regulatory compliance, invoicing, and claims processing, all of which contribute to the overall cost. Administrative costs constitute nearly 25% of the total healthcare expenditures in the United States, according to a study published in Health Affairs. This is markedly higher than the administrative costs of other developed countries with single-payer systems, which are significantly lower. The overall expense is significantly influenced by the inefficiencies that result from the management of numerous payers and the navigation of convoluted billing systems. For instance, the necessity of numerous invoicing departments, intricate reimbursement protocols, and claims verification processes introduces additional layers of inefficiency and expense. These exorbitant expenses may be mitigated through initiatives to optimize administrative procedures and mitigate bureaucratic obstacles. The financial burden on both healthcare providers and patients could be reduced by enhancing system efficiency and standardizing administrative procedures and integrating electronic health records more effectively. 2. Inadequate transparency and price variation. The concealed costs of healthcare in the United States are significantly influenced by price variation and a lack of transparency. The cost of medical services and procedures can vary significantly based on the provider and geographic location. For example, the cost of a routine MRI can range from $400 to $3,500, contingent upon the facility and region. Patients find it challenging to compare prices or comprehend their financial obligations in advance due to this variability. Patients frequently encounter unexpected expenses due to the absence of standardized pricing and transparency in the healthcare system. The financial burden is further exacerbated by the inability to easily compare prices and comprehend the complete cost of care. 3. Exorbitant cost of prescription drugs. Another substantial expense in American healthcare is the cost of prescription medications. The primary reason for the substantial increase in prescription drug prices in the United States is the absence of price controls and the high profit margins of pharmaceutical companies, which are substantially higher than those of other countries. Prescription drug spending in the United States comprises nearly 10% of total healthcare expenditures, as indicated by the Kaiser Family Foundation. Patients with chronic conditions necessitating ongoing treatment may experience a substantial financial strain due to the exorbitant cost of medications. For instance, numerous patients are unable to afford certain life-saving medications due to their exorbitant prices. The financial burden on patients and the overall healthcare costs could be alleviated by addressing the high cost of prescription medications through measures such as price negotiations and regulatory changes. 4. Copayments and out-of-pocket expenses. Despite having health insurance, numerous Americans are burdened by out-of-pocket expenses and copayments. Patients frequently encounter substantial expenses for copayments, deductibles, and coinsurance, which can accumulate to substantial sums over time. In the American Journal of Public Health, nearly 1 in 4 Americans reported experiencing difficulty paying medical bills, with a substantial proportion of these costs being attributed to out-of-pocket expenses. In particular, individuals with chronic conditions or elevated medical requirements may find these expenses to be particularly taxing. The financial strain resulting from out-of-pocket costs can result in delays in seeking care or the foregoing of necessary treatments, which can exacerbate health issues and increase long-term costs. 5. The influence of preventable diseases. the healthcare system in the United States is burdened by a substantial concealed expense: the cost of preventable diseases. Chronic conditions, including diabetes, heart disease, and obesity, are largely preventable through lifestyle modifications and preventive care. Nevertheless, the high prevalence of these conditions in the United States is partially attributable to the limited availability of health education and preventive services. Chronic diseases are responsible for approximately 75% of the nation's healthcare expenditures, as per the Centers for Disease Control and Prevention (CDC). By preventing the onset of chronic conditions and enhancing health outcomes, the overall cost of healthcare could be reduced by investing in preventive measures, including vaccinations, examinations, and health education. 6. Economic consequences of health inequities. The hidden costs of the system are substantially influenced by health inequities and disparities in healthcare access. Individuals from marginalized communities frequently encounter obstacles to obtaining high-quality care, which leads to diminished health outcomes and increased healthcare expenses over time. Higher rates of emergency room visits and hospitalizations for preventable conditions are the result of disparities in access to care, preventive services, and treatment. Targeted interventions and investments in community health programs are necessary to address these inequities. It is imperative to address social determinants of health, improve health literacy, and expand access to healthcare services in order to reduce health disparities and enhance overall health outcomes. 7. Economic burden and indirect costs. Lastly, the economic burden and indirect costs of healthcare are not limited to direct medical expenses. These expenses encompass the economic burden on families and communities, caregiving obligations, and diminished productivity as a result of illness. For instance, individuals with chronic illnesses may encounter diminished work capacity or employment loss, which can result in financial insecurity and reduced earnings. Furthermore, the economic challenges that family members who provide caregiving support frequently encounter, such as lost wages and career opportunities, are significant. Not only do individuals experience the economic consequences of healthcare costs, but the economy as a whole is also affected. Mitigating the economic burden and enhancing overall well-being can be achieved by implementing policies that promote work-life balance, caregiver support, and financial assistance to address the indirect costs of healthcare. In conclusion, it is evident that the financial burden of the American healthcare system is far more extensive than the visible expenses of insurance premiums and out-of-pocket payments as we uncover the concealed costs. Administrative overheads, opaque pricing, high drug costs, and the economic impact of preventable maladies are all part of the true cost. These factors cumulatively contribute to a system in which individuals and families experience significant financial strain, frequently without a complete understanding of the extent of their responsibilities. A multifaceted approach is necessary to address these concealed costs, which includes systemic reforms to reduce administrative inefficiencies, increase transparency in pricing, and efforts to make healthcare more affordable and accessible. Furthermore, the indirect costs of healthcare can be alleviated by enhancing preventive care and reducing the economic burden of chronic diseases. We can strive to establish a healthcare system that is financially sustainable for all individuals and provides high-quality care by recognizing and addressing these invisible expenses. Let us know in the comments what you think about the unseen expenses, the true cost of healthcare in the United States, and don't forget to like, subscribe, and stay tuned for more captivating content on our YouTube channel.